Through analysis of the book Last Child in the Woods, I have chosen to focus on child advocacy in global health because, as Richard Love describes, nature deficit disorder has become a far-reaching issue, impacting individuals from every walk of life in numerous different ways. I possess an intrinsic passion for nature and the outdoors, and through my involvement in healthcare and also as a community member, I hope to advocate for children and an increased immersion into nature. The themes portrayed in Last Child in the Woods are intertwined in the concept of global health via many pathways. The problem of a nature deficit adversely affects both physical and mental health outcomes for children. A focus on this problem and implementation of solutions to correct this problem could potentially improve upon a widespread global health concern. Advocacy is defined as protecting and defending what one believes in for both self and others. Nurses often are expected to advocate for patients when they are unable to speak for themselves. Nursing values central to advocacy emphasize caring, autonomy, respect, and empowerment. These values are imperative in child advocacy because children often cannot speak out for themselves. We must empower them, giving them the adequate tools so that they can experience enrichment through exposure to the natural environment. Through this project and further into my career as a nurse, I hope to advocate for children by working on their behalf to influence both school and community policies that bring nature back into urbanized settings and school environments, provide for more green spaces, and support integration of children into their natural environment. I believe that this integration would positively impact both physical and mental health outcomes for children. Community-oriented primary care is a care model that bridges the medical and public health approaches. In this model, primary care clinicians systematically define a target population, determine its health needs, and develop community-based interventions to address these needs. As nurses, we can be a part of this by assessing target populations with whom we work and by participating in the planning of interventions. The target population for this project is children, and the intervention is nature. We need to assess children's experiences in our communities to understand what is preventing them from accessing nature. We need to educate parents, school teachers, and other community stakeholders and present the evidence for nature. In formulating strategies, we must address the driving forces behind the deficit. These include increasing technology, decreasing open space, and a heightened disproportionate fear that nature is inherently dangerous and must be avoided. If we can take small steps to implement change and positively impact a community, hopefully others will follow suit, subsequently creating a widespread movement of nature immersion. Kids today are experiencing a number of different health issues, most notably obesity and diseases stemming from obesity, as well as depression and attention disorders. From 2011 to 2014, the prevalence of obesity was 8.9% among 2 to 5-year-olds, compared with 17.5% of 6 to 11-year-olds and 20.5% of 12 to 19-year-olds. Additionally, rates of psychotropic drug use have greatly increased in the last 2 decades. Evidence suggests the need for such medications is intensified by children's disconnection from nature. We must strive to increase that minuscule 3% of government healthcare dollars spent on illness prevention. If we can recognize the connection of nature to illness prevention and communicate that upwards, hopefully we can influence health policy to incorporate aspects of nature into children's everyday. We can do this not only as nurses but also as community members through the establishment of natural parks, public gardens, farmers markets, and other forms of urban agriculture. We need to get kids outside, let them get their hands dirty, and help them to forge personal and lifelong connections with nature. Nature deficit disorder, as explained in this book, explores the increasing divide between the young and the natural world, and the environmental, social, psychological, and spiritual implications of that change. Through this project, I have chosen to focus on child advocacy in terms of altering this divide between children and nature. I look at children and I see the future. I look at the state of the world and I get concerned about that future. Our children have the capacity to change the world. It is our job to give them the tools required to do so. Through the last couple of decades, we have watched a steady decline in children's connection with nature correlate with a steady rise in childhood health problems and subsequent medication use by children. I think we need to look closer at using nature as that prescription medicine. I have always believed in nature as a mechanism for healing. Reading this book re-emphasized this belief on a much larger scale. It helped me to see the vastness of the problem and also helped me to explore solutions. For my future nursing practice, I hope to incorporate nature's healing mechanism into my patient care plans. Through one-on-one interaction with my patients, I want to impress upon them my beliefs regarding exposure to nature, reiterate nature's healing power, and make recommendations for nature as therapy. As a medical professional, I will be in a position where I can do research and present evidence to patients and communities alike to make a case for integration of nature into children's and adults' lives, schools and communities, and other urban settings. Through the tangle of smartphones and tablets, laptops, and video games, I do see glimmers of hope. The Natural Learning Initiative is a research and professional development unit at the College of Design at North Carolina State University that was founded in 2000 with the purpose of promoting the importance of the natural environment in the daily experience of all children. They help communities create stimulating places for play, learning, and environmental education. Environments that recognize human dependence on the natural world. We also have the Zoopolis movement that promotes urban parks and incorporates within the parts of nature within cities that are still wild, including integration of animals into these areas. We also have green urbanism, which considers protection of regenerating nature into city and suburb development. Chicago is perhaps the best example of this, with their campaign to preserve open space, recreate wildlife habitat, greenways, stream corridors, and other natural land. Within this campaign, Chicago has constructed a new city hall with a rooftop garden that serves to insulate the building, absorb excess stormwater, help prevent sewer flooding, and act as a giant air purifier. These are positive changes that I hope will serve as the basis for a more widespread movement geared at creating a better future for our children.
Why do you like to play outside?
Because you cause you get healthy and you get a lot of energy. And you could play and you could go stretch your muscles and also get play with you.
Is there anything you like better about playing outside instead of playing inside?
Better outside is that you could have more fun and more space to run around.
Mm-hmm.
Yeah. And when you run around, your bones get lots of energy. You could throw rocks in the river and have fire by the river and hike and
Micah, what do you like to do in nature?
throw rocks in the river, do hikes with my aunties, and I like dig in the dirt, slide on the slide, swing, and I like running around, riding the bikes, yeah, and I like coming back inside when it's getting cold out.